Back to Primetime News and a special welcome once again if you're watching online at onespotmedia.com. The government says it has moved to strengthen security of the Jam COVID website after what it has described as a security vulnerability with data storage. In a press release this morning, the Office of the Director of Public Affairs and Communication at the Ministry of National Security confirmed that the vulnerability was discovered on Tuesday. It went on to say that there is no evidence to suggest that the security breakdown had been exploited for malicious data extraction prior to it being rectified. Travelers whose data may have been impacted were contacted and assured that steps have been taken to ensure the integrity and the confidentiality of the data. Some of the country's most powerful business leaders have pledged to help the government in the distribution of COVID-19 vaccines when they get here. A memorandum of understanding was signed yesterday to facilitate the effort. More of this report from Dwayne Anderson.
In a few days, the AstraZeneca COVID-19 vaccine will be in Jamaica. It will be one of the most important developments in recent memory. That's why influential local groups are being called on to help. On Tuesday, the Ministry of Health signed a memorandum of understanding with several business groups. The groups, as part of the agreement, will, among other things, buy more dosages of the vaccine and help ensure the vaccine gets to those who need it quickly.
To facilitate the distribution in a transparent manner and on a cost-plus basis, that means no profit, of COVID-19 vaccines procured by the Ministry of Health on behalf of such members of the associations.
President of the private sector organization of Jamaica PSO, J. Keith Duncan, admits the authorities are going to have a tough time implementing the COVID-19 vaccine program.
But this is going to be a very complex effort, very costly effort, and if we're to achieve herd immunity in a very short period of time, as we all want, so that we can one, save lives, and two, get our economy and businesses and jobs back up and running, it will take a joined up approach. And we are here willing to support.
The PSOJ president said in addition to the technical support business groups will give to the government, they will also have willing recipients lined up to take the vaccine.
We have had strong indications from our member associations, all wanting to come on board to vaccinate their employees, to vaccinate. So we're fully on board.
Health Minister Dr. Christopher Tufton said the global news around the AstraZeneca vaccine is timely, given some of the suspicions some locals may have about the virus and the vaccines.
Because it's one thing to get the vaccines, it's another thing to get persons to take it. And I want the Jamaican people to appreciate that while we are in a hurry, we're absolutely careful to ensure that the process is safe for all Jamaicans. And these procedures and collaborations are part of that process. Yesterday, we got very good news from the World Health Organization, which listed two versions of the AstraZeneca Oxford COVID-19 vaccines for emergency use, giving the green light for these vaccines to be rolled out globally.
Close to 250,000 doses of the COVID-19 vaccine is to arrive this month, with 125,000 Jamaicans to benefit in the first phase. Dwayne Anderson, TVG News.
In the meantime, Jamaica's COVID-19 case count has now surpassed 20,000, with 243 new cases being recorded on Tuesday. All parishes recorded cases, pushing the island's case count to 20,016. The Health Ministry confirmed the new cases after 1,046 samples were tested. That represents a 23% positivity rate. There have also been 3 additional COVID-19 deaths, increasing the death count to 381. The fatalities are 2 males from St. Catherine, ages 74 and 59, and a 94-year-old man from Westmoreland. The number of persons hospitalized with the virus has also increased to 270, placing even more pressure on the health system. 23 patients are considered critically ill. And the management of the Cornwall Regional Hospital in St. James has confirmed that the COVID-19 ward is full as cases of the respiratory illness continues to pour in. Clinical coordinator Delroy Frey is fearful that if the case count continues to rise requiring hospitalization, there will be a drastic increase in fatalities. Anthony Love reports.
The spike in COVID-19 cases over the last few days is worrying. country's case count now stands at 20,016. Hospitalization has increased, including at the Cornwall Regional Hospital in St. James, where it's understood the COVID ward is full. Delroy Frey is the clinical coordinator at the facility.
And as I speak today, we are at full capacity. In fact, we have 33 patients who are positive currently in hospital that needs hospitalization. And there are 7 suspected cases that we are awaiting result for. So that makes it a total of 40 patients that we are caring for at this point in time.
Despite the growing numbers in hospitals, some Jamaicans continue to disregard the COVID-19 protocols. A visit to this bus park and other public spaces in Montego Bay showed just that. People moving around with no masks, others simply wear it under the chin. The practice is one that Dr. Delroy Frey bemoans. He noted that treating COVID-19 cases along with other services offered at the facility are putting a strain on staff.
My fear is that if this continues to rise, our team will we'll reach a fatigue level. And, we don't want to reach that stage. And the other question is, if the numbers continue to rise that requires hospitalization that is beyond what we have catered for, it means that we have to make other contingencies.
Work has already started. 15 additional beds have been allocated to treat isolated cases should the need arise, but still another challenge.
But this will require staffing as well, which we have to be aggressively looking at. So every day what we have to look at the numbers and anticipate what is going to happen and make contingency in order to care for these people.
Dr. Frere reiterated the call for Jamaicans to play their part in limiting the spread of the virus.
It's always better to prevent something than to treat it. It's costly. It requires money, it requires jobs, it requires manpower. And if we are disciplined enough, we can minimize this thing and conquer it. I would like to get it back down to a very low level so we can look after the patients that requires our care in a timely manner.
Anthony Lugg, TVJ News.
Still to come this evening, 80-year-old brutally murdered in Clarendon. And in business news, Jamaica Customs to give exporters preferential treatment. We'll be right back. Welcome back. We're continuing the news. An 18-year-old Clarendon resident was murdered last night and his house torched. The brutal attack has left residents and members of the political directorate wondering why the senior citizen had been targeted. More in this report from Cody and Barrett.
Burn marks on the windows of this house are signs of the vicious attack that happened around 10 Tuesday night in the Grimesbury community in Clarendon. Reports are that footers fired by the occupants' screams for help led to the police being summoned, but by the time the police arrived, it was too late. 18-year-old Clifton Barry was found inside the house in a pool of blood with bullet wounds all over his body.
I could never and will never even know what to believe that I might have gone into the room of Mr. Berry and taken him out in this brutal way. I believe this is really, really unjustified. And I don't know what ways crime is going in this country, but when you kill and held a man like Mr. Berry, who has always been quiet, calm, very united, a churchman who goes to his church, and someone who's very cooperative and community oriented, he's always considering what can be done to make the young boys and young girls come off the street.
Investigators were on the scene of a murder Wednesday morning, scouring for clues that could help find the killers of the senior citizen. The councillor for the area is adamant these attacks cannot be allowed to be seen as normal, and is therefore insisting that the country's security leaders must act.
The bread bottom of people is burning out. The Prime Minister, Honorable Andrew Holness, you have to do something about crime in this country. It cannot continue like this. There are too many persons' lives are gone. It could be a child, it doesn't matter. So we can't keep on talking about crime every day and yet we do nothing. Things need to put in place, Mr. Holness, as the leadership in this country, and to make certain that we curb and control crime to a level where the citizens can be comfortable. And I cannot understand. When I saw a survey done
and citizens are saying they are more comfortable in their homes. It is unbelievable to me. Because I don't know who could be comfortable in a crime-filled country like Jamaica now.
Cody Barrett, TVJ News.
One medical doctor says caustic agents such as bleach continue to be a major household hazard in Jamaica. As such, there is a call for parents and guardians to be more vigilant with their child or children, especially around unlabeled bottles with chemicals. Jamala Pullen tells us more in this evening's health report.
The health report is brought to you by
caustic agents are strong acids or strong alkalis that can cause severe burns to the mouth, throat, or stomach. Consultant ear, nose, and throat surgeon Dr. Merton Smith says these agents are extremely dangerous.
In addition to damaging the digestive tract, sometimes during swallowing these agents, patients can choke and have some of these agents get into the voice box and into the lungs, creating even greater problems with their breathing and respiration. And that can actually be life-threatening.
Dr. Smith says the swallowing of caustic agents remains a significant problem despite public education.
We did notice that around 2014, there was somewhat of a reduction in the number of cases, but the cases do continue. And this is a problem because it is a very preventable issue. Unfortunately, most of the persons who swallow caustic agents in Jamaica are children. It's about 80%. And a lot of them are actually between the 0 to 5 age group.
The ENT surgeon is advising parents and guardians to place chemicals out of the reach of children.
You should ensure that you collect and store your chemicals in properly labeled bottles. Never store chemicals in bottles that are used for storage of drinking substances such as sodas and juices, because that can be very misleading and can result in even adults accidentally drinking caustic agents.
With your health report, I'm Shamala Pullen, wishing you good health.
The health report is brought to you by